Hello everyone, my name is Dr. Lina from Dental101. Today we are going to have a very important video, something that you have asked a lot before in the past, and it's about a generic approach for OSCE communication stations. Copyright and disclaimer. All content included in this presentation is property of Dental101 Pty Ltd or our associates and protected by Australian and international copyright laws. You may not copy, reproduce, distribute, publish, display, perform, modify, create derivative works, transmit, or in any other way exploit any part of copyrighted material without permission from Dental101 Pty Ltd. Dentistry is both an art and a science, and pursuing a course with Dental101 does not guarantee pass or success. We are helping build upon the candidate's overall clinical knowledge and experience within the framework of examination preparation. The candidate is expected to have a certain baseline knowledge and experience. The content of the course is evidence-based, and it is candidate's personal discretion as to how to use that information. Dental licensure examination pattern requirements are ever evolving, and the pace of learning and use of knowledge is different for every individual. So basically what you have here on the screen is something that we tend to use as a guide for our candidates. And I say a guide because first of all, this is only a suggestion for our candidates. It's something that is going to help them to structure their OSCE cases very well. But definitely this is something that we haven't invented. You can find different types of generic approaches, with different courses, and that's okay. The idea is that as a candidate, you just stick to one generic approach that is going to help you build your structure, and it's also going to give you consistency throughout the entire OSCEs. So what you are seeing here on the screen is basically 15 bullet points that are going to help you not to forget the important things that you need to include in your OSCEs. Having said that, it's not that all 15 points need to be included in every single OSCE. You need to adapt this generic approach to a particular OSCE. What I mean by that is, if we are talking about, let's say, a perio case. For a perio case, family history is quite important. So we don't want to forget point number 5, because we know family history is some of the things that we need to ask to people or to patients that have any kind of perio history. But if we are talking about a trauma case, if a patient comes to you because, had an accident and now, one tooth is avulsed, family history is not going to make a difference in your case. So why would you like to spend time asking about family history if it's not something that you need to include in that particular case? So I hope that makes sense for you. And the first thing that we want to do when we are seeing a patient is we want to hear the history of the chief complaint. We want to know why the patient is there. Obviously, if it's a trauma case and the mom says, I'm bringing my daughter because she had an accident, that's a chief complaint, and definitely we need to take a history of that. So we are going to start asking when this happened, and any loss of consciousness, and all of the things that you need to know about the history of chief complaint. If we are talking about a patient that has pain, and the patient has something that you suspect to be a irreversible pulpitis, so you want to ask the characteristics of the pain, for how long the pain has been, if the patient has taken any kind of medication for that pain. Everything regarding the history of the chief complaint needs to be there, and ideally, I do think that that will be the first thing that you need to do. Because after you have an idea of why the patient is there, then you can decide if the second point up until the 15th point, which one of those needs to be included in there. Then we are going to move to the dental history. Also, if it is appropriate, we are going to ask the patient about when was the last time that the patient visited the dentist. If the patient says, like, I'm super anxious, I don't like dentists, which happens a lot, we want to investigate a little bit more about the roots of the sources of that anxiety or fear to the dentist. So tell me, have you had any bad experiences? What has happened? So, obviously, if we are seeing that we have time for that. Remember that for the purpose of the OSCE communication stations, we need to adjust to a 10-minute time frame, which is tricky. That's why we need to be very clever on what things we are going to include in there. And that's why a generic approach is going to be very useful. It's not for you to recite everything by memory. It's just for you to have a guide. Then we can move to medical history, very important as well, if it is appropriate, if it is not mentioned, because if we are talking about a case of the clinical treatment and evaluation cluster, for example, probably the clinical history is already mentioned in there because the patient already had a treatment and you need to treat some kind of complication. So probably we don't need to go into much detail in the medical history. Then we move to the social history, and here we have everything that is related to alcohol intake, everything that is related to smoking, and for some cases, something associated with patients' work environment, which could be important in order to establish stress patterns or access, for example, geographic tongue, strongly related to stress. So that will be part of the social history. So all of those things, you need to be very quick on your feet the moment that you are doing your OSCE, so you can know what things are going to incorporate in there. Then we have family history. I already mentioned that. Very important for perio cases, so you will need to assess if that is important. If we are talking about any suspected cases of amelogenesis imperfecta, family history is important, so we want to include that there. So we know that we have an OSCE about molar incisor hypoplasia, and some of the differential diagnosis could be amelogenesis imperfecta. So if I'm going to investigate family history is going to give me a very good approach to what type of disease I'm dealing with. Then we are going to the diet, especially important for cases like caries risk assessment is quite important. Also for cases related to ulceration, angular cheilitis, because we know that vitamin deficiency can have a role in this. So any type of restrictive diets, vegetarian, vegan, something that can help you rule out possible causes. After we have done that, we need to move to investigation, a special test. You need to explain to the patient that if the patient has something that you suspect to be cracked tooth syndrome, you are going to do some tests, percussion, cold test, frag finder test, and all of those things needs to be explained in very simple and layman terms to the patient. Then we move to signs, and I think number 8, 9, and 10, and I will say 11 as well, they kind of go together. So, because if you need to establish any kind of differential diagnosis, you need to explain the signs and symptoms that you are seeing, also the risk factors or the modifying factors. At the same time, pathophysiology. So, 8, 9, 10, and 11 is something that you need to start rehearsing as a single thing. Because if you can include all of those in a single paragraph, in a single speech, you are going to save a lot of time. We don't want to go, okay, your signs and symptoms are this and this and this and this and this. Therefore, your diagnosis is this and this and this and this. Because you have these risk factors. And the pathophysiology is this. If you can combine everything in something more fluid, more cohesive, it's going to sound better, and it's also going to save you a lot of time. And then we have treatment options, and remember that when we have treatment options, we can have pros and cons and complications. That will be something to explain to the patient. We can also have some short-term, long-term treatment, something that also needs to be explained to the patient. Referral, if it is something that you need to do, and obviously review appointments, quite important. I will say in pretty much all the cases, if you are going to do, let's say, you saw a patient that had trauma, you need to revise the patient again. If you are seeing a patient that you think is a geographic tongue and you give that diagnosis or differential diagnosis to the patient, you need to revise that patient as well. If you have a patient with ulceration, you want to see that patient in 2 or 3 weeks time just to see that everything is subsiding. So I think all of those things need to be organic. You need to be very clever on how to incorporate all of that. Again, this is just a guide. It doesn't mean that everything needs to be in every single case. The order could be different. It's up to you. What we have put out here is something that has sense for us, that in my personal experience helped me a lot, but you can adjust it as you like, as long as you incorporate everything in your OSCE and you don't forget anything. So that's pretty much what I can tell you so far about the generic approach. I know that a lot of people have questions about how to train for OSCEs, who to train with OSCEs, and we can have different suggestions for you. Having like a partner to study, it's quite important. Some people prefer to have some more of a professional guidance because sometimes when you practice with people that hasn't passed their exam, the feedback is not very on point. So I will just going to leave this information for you guys here on the screen. We have a program that we call OSCE Communication Buddy, which is quite interesting because as instructors, we meet one-on-one with a candidate that wants to have that session with us, and we discuss the cases that basically the candidate wants to discuss. So if you are interested in that, just give us a call or Google us in dental101.com.au, or you can call us if you are here in Australia or not to 045-101-7076. So thank you so much, guys, for watching this. I hope this information is going to be helpful for you and is going to contribute a little bit to your preparation. Bye.